I was born and raised in Sioux Falls, actually. My parents still live in the same house that I lived in my entire life, and then decided I want to stay in South Dakota, and so I went to the University of South Dakota for undergrad. And then when I decided I wanted to do medical school, I was already pretty comfortable in Vermilion, so ended up staying there for medical school. I went on to do internal medicine residency in Iowa, and then followed by my pulmonary critical care fellowship in Omaha at the University of Nebraska Medical Center. When I got into internal medicine residency, I found myself really drawn to the ICU and everything that it had to offer. It was a good mix of everything I loved about internal medicine, and then there were procedures and really good patient conversations and interactions. When I was in college, actually, my grandmother had developed a really severe lung disease and was in and out of the hospital a lot, and my mom was kind of her primary caregiver at that time. And so she spent a lot of time at our house, and I've kind of witnessed how that interaction went and how her interactions with her doctors went, and those constant feelings of shortness of breath and feeling like she couldn't quite ever get comfortable. And so I felt very much like this is something that I would want to help with if I could. And so when I found out that the fields of pulmonary and ICU go together typically, that was a really nice surprise, because I felt like it's something that I could do both the outpatient patients with chronic lung disease and help them, as well as inpatient, whether it's the end stage of your chronic lung disease or just an exacerbation or something else. I could take care of patients in the hospital as well. I feel like this is something that I'm called to do, that this is something that I, in my bones feel like this is the job that I'm supposed to be doing. Helping patients understand what their disease process is and what that means, and then what I can do to make them feel better or more comfortable, because I think it's a scary thing for people, especially with disease, with shortness of breath. If I can help people understand that, that's number one priority. And then if I can make people feel better, that's just icing on the cake for me. I recently retook up running. I used to run half marathons, and so my goal is to try to do that again. Trying to enjoy reading for fun, not, reading medical journals. And then I really like baking, and so I'm trying to spend some time with my parents right now, learning some of those old recipes that we have, and so that's kind of my goal for the next at least year or so.